Welcome back to our channel, Just Immigration News. Imagine this. The government is grinding to a halt, national parks are closing, and federal workers are missing paychecks, all because, according to some loud voices, Democrats are fighting tooth and nail to hand out free healthcare to undocumented immigrants. It's a claim that's exploded across social media, cable news, and even the campaign trail, racking up millions of views and shares. But here's the million-dollar question: is it true? Or is it just another round of election year spin? If you're new here, hit that subscribe button and ring the bell. We drop myth-busting videos like this every week. Let's get started. First things first, let's pinpoint exactly what this claim is. It gained massive traction during the recent government shutdown standoff in October 2025. Former President Trump blasted it on social media, saying Democrats want to blow $1.5 trillion on healthcare for illegal aliens. House Speaker Mike Johnson echoed it, accusing Democrats of demanding hospitals pay more to treat undocumented immigrants than American citizens. And Republican leaders tied the whole shutdown mess to a supposed Democratic plot to restore taxpayer-funded health benefits for illegals. Sounds alarming, right? It plays on real frustrations about immigration and healthcare costs. But as we'll see, the devil and the debunk is in the details. Spoiler: this claim doesn't hold up under scrutiny. The facts on undocumented immigrants and healthcare. Okay, let's break this down step by step. Step 1. What does federal law actually say about healthcare for undocumented immigrants? The short answer? They've been ineligible for most federally funded programs for nearly 30 years. Back in 1996, a bipartisan law signed by President Bill Clinton, the Personal Responsibility and Work Opportunity Reconciliation Act, slammed the door on undocumented people accessing full Medicaid, CHIP, or Affordable Care Act subsidies. That's not changing anytime soon. Undocumented immigrants can't buy subsidized plans on the ACA marketplace, and they don't qualify for Medicare. Period. But, and this is a big but, there's one narrow exception: emergency care. Under the Emergency Medical Treatment and Labor Act, hospitals must stabilize anyone in an emergency, regardless of immigration status or ability to pay. Medicaid then reimburses hospitals for that emergency-only care through something called Emergency Medicaid. We're talking life-saving stuff like treating a heart attack or childbirth complications, not routine doctor visits or checkups. The cost? About $5 billion a year nationwide, mostly absorbed by hospitals and states, not a blank check from taxpayers. Now, some states like California and New York use their own funds to offer limited coverage to undocumented folks, think kids or pregnant women, but that's not federal money, and it's not what Democrats are pushing for nationally. So no, there's no secret Democratic scheme to flood the system with freebies for border crossers. Experts at places like the Kaiser Family Foundation confirm undocumented immigrants are already barred from these programs, full stop. What lawfully present get? Where does this claim really come from? Enter the Big Beautiful Bill Act, or OBBBA, H.R. 1 signed into law by President Trump in July 2025. This was the massive tax and spending package that included no tax on tips, overtime breaks, and Social Security tweaks for working families. Sounds great, right? But buried inside were deep cuts to Medicaid and ACA subsidies totaling over $1 trillion over 10 years. Here's the twist. Those cuts didn't just hit programs broadly, they specifically stripped eligibility from certain lawfully present immigrants. Who are these folks? Think refugees fleeing war, asylees granted protection, DACA recipients who came as kids, or people with temporary protected status from disasters back home. These are about 1.4 million people total, not undocumented border crossers flagged for deportation. The Congressional Budget Office estimates 1.2 million non-citizens, all lawfully present, lost ACA subsidies because of it. Fast forward to the shutdown. Democrats' counterproposal? Repeal those immigrant-specific restrictions in one Big Beautiful Bill Act and extend the enhanced ACA premium tax credits that expire this year, credits that help 4.2 million, mostly U.S. citizens and lawful immigrants, afford their plans. It would restore coverage to those lawfully present groups, but not undocumented immigrants. Leonardo Cuello, a health policy expert at Georgetown University, puts it bluntly: Whether the healthcare changes in the One Big Beautiful Bill Act are repealed or not, it makes no change to coverage of undocumented immigrants. And that $1.5 trillion figure Trump tossed around? That's the total cost of the Democratic spending package over a decade, mostly for domestic priorities like child tax credits and infrastructure, not some immigrant slush fund. NPR's fact-checkers nailed it. Republicans often blur illegal immigrant with lawfully present, muddying the waters to score points. We've got voices from across the spectrum here. Factcheck.org calls the $1.5 trillion immigrant claim totally false. PolitiFact rates Speaker Johnson's hospital payment twist as misleading. And even the nonpartisan Kaiser Family Foundation agrees. Rolling back One Big Beautiful Bill Act doesn't open the door to undocumented coverage. It's a classic case of conflating Apple's lawful refugees with Orange's undocumented arrivals to fuel fear. The claim that Democrats are sabotaging the government to give undocumented immigrants free healthcare? Debunked. It's rooted in long-standing laws that already exclude them, twisted around a bill that targeted lawful immigrants and everyday Americans' subsidies. Getting healthcare right means protecting everyone who plays by the rules: citizens, refugees, and yes, stabilizing emergencies for all without the misinformation that divides us. What do you think? Drop a comment below. Have you heard this claim circulating in your feed? Let's discuss fact versus fiction. If this video cleared things up, smash that like button. It helps us reach more people with the truth. And don't forget to subscribe for weekly breakdowns on everything from taxes to tech. Thanks for watching. Stay informed, stay kind, and we'll see you next time. Take care.